Some hospital dramas may portray hospitals to look like this. Or they may look like this.
Who's that?
Her stuffed animal?
He's a puppy.
Yeah.
During the Crimean War, hospitals were filled with disease and did not contain enough supplies to help the injured soldiers. The hospitals were drastically understaffed and proper care was unable to be given. Thanks to Florence Nightingale, that was all about to change. Florence Nightingale was born in Florence, Italy on May 20th, 1820. Nightingale was the youngest of two daughters born into a very affluent family. Nightingale was given a rich education with a large focus in mathematics, but the expectation was that she would marry a man of means. While Nightingale loved mathematics, her earliest passion was caring for the weak and ill. She administered care to the neighboring village of her family's estate and decided that nursing was her calling. Her family forbade her from pursuing her passion. After refusing a marriage proposal from a man that had pursued her for years, Nightingale enrolled as a nursing student at an institute in Germany. After finishing her studies, Nightingale moved to London, where she took a job at Harley Street Hospital, where she took care of sick governesses. Her passion and performance at the Harley Street Hospital was so impressive that she was soon promoted to superintendent. She also began volunteering at another hospital where they were battling cholera and unsanitary conditions. She knew that more needed to be done in order to help the patients survive. In 1853, the Crimean War broke out. At this time, there were no female nurses stationed in Crimea. England was in uproar when they learned of the neglect that their ill and injured soldiers were receiving. The government was unsure of what to do and knew that there needed to be reform. In 1854, Nightingale received a letter from the Secretary of War asking her to put together a corps of nurses to go to Crimea. Nightingale assembled a team of nurses and sailed to Crimea within a few days. They had no idea that the conditions would be so bad. Nightingale and her nurses arrived at Scutari, which was a British-based hospital in Constantinople. Patients were lying in their own excrement on stretchers in the hallway, and the entire building had become a cesspool. The basic supplies such as bandages and soap were scarce, and the number of ill and injured soldiers rose. Along with terrible conditions, record keeping in the hospital was almost non-existent. Soldiers were being buried without their deaths being recorded, and they were dying of infectious disease more so than the injuries sustained in battle. Nightingale went to work with first having the least sick soldiers scrub the hospital from floor to ceiling to disinfect everything. Nightingale took care of the soldiers in every waking minute, which is where she deemed the nickname the Lady with the Lamp. Her efforts reduced death rates by 2/3. Nightingale knew that this was not enough. She began keeping records of the soldiers and the deaths, which produced the book Notes on the Matters Affecting Health, Efficiency, and Hospital Administration of the British Army. She stated that our soldiers are enlisted to die in the barracks. The famous statistician from London, William Farr, helped analyze Nightingale's data, who reported her findings to the General Registrar's Office, which held the records of births, marriages, and deaths. This was the beginning of the creation of the modern discipline of vital statistics. Once Nightingale returned from Crimea, she was known as a heroine of the war. She began a campaign to reform the Army's medical department and was summoned by Queen Victoria. She gained respect and support from the Queen and Prince Albert in her campaign to better the Army hospitals from how she presented her data. Nightingale knew that she needed to present her data in a way that the Queen could understand. She was one of the first statisticians to display her data in pictorial form. She developed several graphic models, but her most famous is the polar area model. Her graph was the most significant piece for the reform of medical care in military and civilian hospitals. It showed that needless deaths due to disease could have been avoided in sanitary conditions. Her record keeping spread to the rest of the civilian hospitals, and they eventually adopted a form that Nightingale had created. Her use of statistical data and record keeping led her to be the first woman to be elected as a Fellow of the Statistical Society of London, as well as the Statistical Congress, where she was an honorary foreign member of the American Statistical Association in 1874. Nightingale left a legacy for the need of standardization in government. Her statistical work led to a large decline in preventable deaths in both military and civilian hospitals. Her work is important now because the same graphs are still used for the public to understand. Although Nightingale remained bedridden for many of her remaining years due to an illness contracted in Crimea, she spent the time advocating for sanitary conditions and published 200 books, reports, and pamphlets. Queen Victoria awarded her with the Royal Red Cross for her dedication. She died at age 90 on August 13, 1990.